Hi everyone, we're excited to launch our new series where we'll get to meet the members of the SIO, the Society for Integrative Oncology team. Through this series, we aim to educate the public about integrative oncology and the unique perspectives integrative medicine brings to patient care. Starting off today, we have the homeopathy SIG with us. Hi, Dr. Frankel.
Hello, how are you?
Good, how are you? And hello, Dr. Gowan.
Hi, good afternoon, morning, evening, wherever you are in the world.
Dr. Frankel, may you kindly introduce yourself?
Okay, my name is Moshe Frankel. I'm Director of Integrative Oncology Service in Rambam Medical Center in Haifa in Israel. Previously, I was the first medical director of the first clinic of integrative oncology in MD Anderson Cancer Center in Texas. By training, I'm a family physician. I'm not an oncologist, but I think that it has advantages and it has disadvantages, but I think it has more advantages sometimes. And so I still practice as a family physician and as an integrative oncologist.
Nice to meet you, Dr. Frankel. What about you, Dr. Gowan?
Hi, welcome. I am Dr. Christina Gowan. I'm at the University of Arizona, and I'm a malignant hematologist, integrative oncologist, and educator. Started the first integrative oncology fellowship program in the United States and co-chair the Society of Integrative Oncology Education Special Interest Group. So again, welcome and thank you for joining us today.
Nice to meet you. And I am Tabarak. I am a medical doctor. I recently graduated from medical school back in 2023, and I'm starting my internship in a couple of months in the UK, Ipswich Hospital specifically. So we're just going to ask a few questions relating to homeopathy and how it relates to integrative oncology. First question being, what can we understand the role of homeopathy in cancer care as a supportive modality, including its popularity and utilization across different regions?
Okay. Basically, homeopathy is a form of healthcare that is developed in Germany and is one of the leading complementary and integrative medicine therapies used in integrative oncology in Europe, India, and South America. The main role is in supportive care, improving quality of life, and reducing common symptoms that patients experience through their cancer trajectory. In the US, the CDC in 2015 mentioned that homeopathy is used by a small segment of the population, only 2.2%. But on the other hand, 80 countries around the world use homeopathy. And in European countries, it's recognized by some European countries by law. And as far as integrative oncology, it's one of the most common therapies being used in integrative oncology in Europe.
That's very nice. Our second question is, explore the current state of research in homeopathy in cancer care, including recent clinical findings and insights published in peer-reviewed journals.
Okay. If you do a search on homeopathy, you have on PubMed, you have more than 6,000 citations just on a simple search that I did just about a month ago. If you did it 20 years ago, it was 1/3, about 1,800 citations. So in the past 10, 20 years, the amount of interest and research on homeopathy has grown from in vitro studies to animal studies to epidemiological studies about use of homeopathy in different kinds of countries and settings. And there are clinical trials that has been done on homeopathy in different parts of the world. And some of them are RCTs. There is mixed criticism about the quality of the trials that have been going on, but there are some RCTs that actually do support the use of homeopathy in cancer care.
Okay, and moving on to our last question. Identify common symptoms in cancer patients such as fatigue, anxiety, and hot flushes, and understand how homeopathic treatments can offer supportive care for these treatments.
Well, when we look at the data that is coming from French clinicians that utilize homeopathy, they mentioned that they have the best response in treating specific symptoms that patients experience during their cancer trajectory. And one of the common symptoms that they feel that they can help patients is fatigue, anxiety, different skin problems that are common due to therapy like radiodermatitis, and joint pain, sleep disturbances, sometimes neuropathy. And there is a few studies that actually check feasibility, and you can see that the same symptoms can be managed in different parts of the world by using the homeopathic treatments.
Perfect, thank you. Now, moving on to the fourth question, what does being an SIO member mean to you?
Okay. I've been in SIO for more than 20 years, just from the beginning of the SIO. I was very interested in this specific topics when I was participating in the University of Texas medical branch as a researcher and a clinician that tried to integrate complementary medicine into the into the medical school curriculum. And through that, we moved into cancer care. And this is where I slowly gravitated to MD Anderson Cancer Center and started a new clinic there. So I've been with the SIO for the past, since the beginning, and I've seen how the SIO has developed. In the beginning, SIO used to be only research and much less clinical practicalities being discussed. Now it's changing, and we have more practitioners and oncologists that we never had before that actually utilize integrative oncology in their practice and looking for ways to research and disseminate this information. So the SIO is becoming the leader, a world leader on integrative oncology worldwide. So this is why I feel very strong about being a member in this society.
Same thing applies to me. I'm really excited to be here. It's only been a few months, but it's been really life-changing for me. Thank you so much, Dr. Frankel. Thank you for introducing us to homeopathy. And we welcome you, the members, to sign up to SIO to become a member and join us this October in the City of Hope, where we're having our conference. Dr. Gowan, would you like to add a final word?
Well, I would like to say thank you, everyone, for your interest, for tuning in. And if you'd like to join Tabarek and myself, Christina, on the Education Special Interest Group as well, the Society of Integrative Oncology, become a member, send us an email, and we would love to welcome you into our committee.
Thank you, everyone.
Thank you. Thank you.
Thank you.
Okay, so 3 seconds. Sorry, let me look for the